I'm with Linda Hartley. Hi, Linda.
Hi, Serge. Hi.
So, Linda, you started in life as a dancer, then became a somatic psychotherapist.
That's right, yes. So how did I get from there to there?
Yeah.
I think, even before I was dancing, I need to say that writing was my first interest, but I came into dance quite late, and I came into a field of dance, being called new dance, which actually led me quite quickly into recognizing the healing and therapeutic aspects of dance and movement, and a way of working that was really about connecting to the inner sense of the body. So I was quite quickly working in the somatic field of dance work, and that took me to study many different practices, but primarily body-mind centering with Bonnie Bainbridge-Cohen, and that became a foundation for a somatic movement practice that I still am very much involved with. And it was really out of that work, recognizing the depth that the somatic work could take myself and others, my students and clients, that led me to want to train in psychotherapy. So it was out of a need for finding ways to both support and hold and contextualize what was coming up in the somatic work that my path led me into psychology. That's
a very interesting, different path from, say, people who started with psychology, psychotherapy. What you're saying is that there's an experience in dance, that experiencing the healing aspect of it, and the somatic part, and that psychology was a way of contextualizing what your experience was.
Absolutely. I feel I learned so much psychology, if you like, through the somatic work, through the somatic practices, but I didn't really have the language or the theory or the therapeutic skills at that point to really work in the depth that I knew that work could offer. So I think my psychotherapy training was a lot about bringing that somatic work into another level of a more conscious level, which I also see as reflecting the developmental process from the sensory emotional processes into the more cognitive, mental cognitive processes that the infant and child are going through. So I kind of went through my own development in a way, in that way of training.
Yeah.
So the body is still very much a base and ground for what I do, the somatic work.
Yeah, and it's very interesting in a sense of, what integrating different disciplines is that you have one and you sense something through the movement, through the somatic part about the psychological, so the phenomenon exists in and of itself, but you need to learn another language, another perspective, in order to draw more about that side. And once you have learned both the somatic and the psychology and integrated both in your own life practice and experience, something else comes out of it.
Absolutely, yes, absolutely. And I think there's something about, Jung talked about this, didn't he? The need to address at all the levels for material to be fully integrated. So there is something about, for me, each of these disciplines really needing the other to fulfill its potential. So the somatic needing the psychological and the languaging of the experience, and the giving meaning to the experience in that more cognitive way. And for me, the psychology needs the grounding absolutely in the body and in the somatic grounding of experience. So I suppose the cultural split that we've all experienced over centuries of mind-body is a little bit reflected in what I'm talking about here. And so the practices that are emerging now in our culture are very much from both the somatic and the psychological, I think, about bringing these dimensions of ourselves and of our practices together again.
Mm-hmm. Mm-hmm.
So yes, hopefully something new, new understandings emerge out of that process.
So you have been practicing as a psychotherapist who integrates a somatic perspective with your psychotherapy. So what is it like in your practice? What do you do that's different, say, from colleagues who are doing psychotherapy without that somatic component?
Mm-hmm.
Or how is your somatic approach different from other people who have a body-oriented approach?
Mm-hmm. Well, a lot of what I use would look similar to a body psychotherapy approach, I think. Perhaps what I might bring from the somatic work is a very subtle understanding of body process. For example, we go into the experience of let me give you an example. The experience, which is foundation of the cell. This is our foundation, in a sense. And for me, the cell, with its membranous skin, if you like, can reflect the experience of the client, the way the client experiences their psychological skin or boundary or interface with the world. So that might be a place of very subtle exploration if we were exploring the issues around boundaries, around interface. There are many other options of practicing, for example. It might be through a meditative process, it might be through hands-on body work that's bringing awareness to this level of what we experience when we go to embody the cells and the cell membranes. So that gives us information and about our sense of psychological boundary, a sense of containment, integrity, if you like.
So there is a sense for you that, in a way, from the most basic part of us, at the cellular level, there is a sense of having a boundary and of, using that boundary. And so the therapy is about revisiting this as a very basic issue.
Yes, absolutely. So the boundary, which I prefer to use the word interface, because a lot of people get a little bit of a solid feeling about a boundary. So the boundary is an interface between the inner and the outer, the self and other aspects of self.
And talks about the breathability of of that interface.
Absolutely. Yes. Absolutely. So that there is movement and communication between the inner and the outer. And as I see it, most of the problems that people bring into therapy are in some way or other to do with difficulties around that, containment, communication, relation of the inner to the outer. So in some way or other that is going to come up. And by sourcing back to our innate cellular being, if you like, we can access information that might have very early roots, might have earliest roots in the embryology, that can be helpful and useful in exploring how we are, now as adults in our interface with the world and with others, what we might be needing. And a certain amount of what we call movement repatterning, a certain amount of repatterning is possible, potential at the somatic level.
So, in what way does one get in touch with that experience of the cell?
Through, first, it might be through, I wouldn't necessarily do this in a psychotherapy session, but in a teaching context I would. We would look at pictures, we would have images, we would talk about the structure and the function and so on. And I might sometimes with a client do this, but that would depend on the situation. I might be doing it with the client hands-on, so I would be talking them through to imagining the form of a cell that's contained by a membrane in the same way that the body is contained by its skin membrane. So it's the microcosm and the macrocosm, and when we access one, we can find an access into the subtler level. So we might begin with the skin and having some awareness of skin, and then imagining the cell beneath the skin with its own membrane. So it starts with a kind of visualizing process. And then the process of embodiment is terribly difficult to describe it. It eventually happens where we can feel as if our awareness becomes centered within the body, within the cell, rather than looking at it and visualizing it. We can feel as if we're perceiving from within it, from within the body. So I think that's the essence of somatic work, really, that we're perceiving from within the body. We're not looking at it, imagining it, visualizing it, analyzing it. So we come to a sense of feeling from within.
Yeah.
Yeah, does that make sense?
Yes.
You can even feel it a little bit as we're talking, a little sense of that.
Yeah. Yeah, so that's a very nice way to put that. Instead of, in a way, having a sense of looking at the self from the outside, have that sense that comes from inside.
Yes, absolutely. Yeah. And then incredible insight, information, wisdom sometimes comes out of the experience when we're really able to center ourselves in the body tissues in that way. So quite hard for me to describe that process. It is what happens when we really are able to. It requires a certain letting go of that cognitive level, a coming down underneath of our rational thinking processes to access something of the innate knowledge of the body, I think, and memory perhaps that we hold there.
Yeah. Letting go of that orientation to figure out or to see as if from the outside, and to kind of sense from inside. Absolutely,
yeah. So a lot of the work in a therapy context might involve, inviting the client to keep sensing into their body and sensing where, to come to or to connect the thinking processes in the body through sensation, and then through the sensation, what is the feeling within or behind that, alongside the sensation. So grounding the thought process, which is, I think, very common in body psychotherapy. We have another language, perhaps, that can at times address a more subtle differentiation. Are you in your blood in this moment? Is that your heart, or is it your stomach, or is it bone? Is it the feeling of bone or muscle? So we might be bringing a subtler differentiation of where the attention is centering in the body.
Yeah. So again, talk about sense, sensation. Different schools of somatic psychotherapy put the emphasis in different places. Some just on sensation, some on the muscles, some on what I'm hearing from you is something that includes a general felt sense as well as some specifics about not just say muscle sensations, but something like the bones, the blood.
Yes, absolutely. And this is the work I learned from Bonnie Bainbridge-Cohen in the body-mind centering practice to experientially explore all of the different body systems. So I might be sitting with a client and I'm feeling a certain energy in myself that I recognize as belonging to the endocrine system. There's an activation of the endocrine system in that moment, which will feel a little bit different from a client who is in a more organic process. Maybe there's something in the digestive system that's really been activated. So there's a different quality of energy when their experience and their expression is located differently in different systems. So that's one of the sort of ways that we might be differentiating how is the person, and what might that mean? What different energy, different kind of processes coming as they center themselves in that way.
So this is happening as you are also discussing their issues, or how does the dance between the psychological issues and the somatic work take place during a session?
Mm-hmm. Well, that obviously varies a great deal, and I do have some clients where we mostly work in a verbal sitting in the chair context, but I have others where we might be doing a lot more active movement work, sometimes body work. So it does vary a lot. But as I'm listening, I think in this is not different from any psychotherapy. I'm endeavoring to also tune into what I'm experiencing. And maybe sometimes I notice something comes to my attention that I'm experiencing in my body in a particular way. So it might be just something that I note for future, or it might be something to reflect and bring into the dialogue that could possibly take us into some exploration, maybe a more internal body sensing exploration, or it might be a movement expression, taking that experience into some sort of expression, or it could be that that's information that would later lead into some hands-on work, some more focused body work, that something was calling attention as we were talking, as we were dialoguing, that we might explore at some point in that more somatic way. So there's not one particular way of using the information, but it's very often about holding the information and building a context, finding where the psychological issues that are being talked about and expressed in the relationship interface with the somatic material and the somatic information that's coming up. And that can also come up in the client's movement, of course, looking for often quite subtle unconscious gestures that the client might be making, can be also indicating something that's going on inside of them that we might take into a somatic exploration in some way.
Yeah. So as I'm listening to you describing this, I'm realizing I have a visual in my mind of, say, therapist, client sitting, 2 chairs, normal, standard office, conversation going, but superimposed to that, realistic picture, I have this vision of 2 cells and the space between them as a membrane, and that communication going back and forth, and including some being retained and processed, and some of the processing happening inside, and some happening in the exchange.
Yes, that's a lovely way of putting it. Absolutely. So an awful lot of the information exchange is not going to be conscious, and there will be some processing that goes on without naming it, but by if I'm able to become conscious of something that's resonating in me in that moment that I do believe facilitates the process between us in some way. So it's quite a lot of subliminal work, but the more that can be brought into consciousness, I think the more the process can be helped along in some way.
Mm-hmm.
I'm having, as you're speaking there, I'm having an image from one of the aspects of the embryological process, which maybe I can just describe this.
Great.
Because I think it relates there. So I'm going into the embryological process about 6-7 days, and before the structure that's now called a blastocyst, the pre-embryo, embeds and implants into the uterine wall, it hatches. It does this remarkable thing. It hatches. It's a round sphere of cells, and it's surrounded by a membrane that's a little bit like a suit. I think of it as like a tight suit, or maybe one of those rubber diving suits that if you can imagine wearing something like that. And it hatches out of this, and in that process, the cells on its surface expand, and this is a preparation for meeting, for the first coming into relationship with the mother, if you are reconnecting with the mother. So this process of hatching, when we're sitting there in dialogue, like two cells, as you describe, there can be a sense of maybe a tightness, maybe we're withholding, we're still contained, or there can be a sense of having opened up to each other. So there's a real sense of free flow of energy and meeting and potential connecting, coming into relationship. So that might be one little process that I would be reflecting on, how maybe that comes up in a particular moment for me. Tight suit.
Yeah. So what you're saying is from that very early point of, say, 6 days on, there is already this is a detailing of the experience as an interrelational process.
I do. The more I study the embryology, I see that all of the pathways for developing attachment and social interactions are being explored and embodied through the process of the embryological forming and even the pre-embryo. So it's all there somehow in those first few weeks, which is an extraordinary process and can be accessed and then brought back into the adult relational context to see what we can learn from that and what might be processed from that.
So how can we actually bring that into looking at the adult process?
Well, it's actually, once a client is familiar with this particular way of somatic embodiment of being able to experience the body from within, being able to feel that they can perceive from the body and they can center themselves in that way, then it's actually a very simple process. You imagine the movement or the structure, the form. So in this instance, the form is to be a small clump of cells surrounded by a sphere, a containing membrane of cells with this outer covering, outer coat. And then we just simply imagine opening, releasing, letting go of that outer coat. And we do that in relationship. So we explore that in dialogue with a partner. I'm talking about a training situation here. Mm-hmm. I might be doing this with a client where we can do this with a partner. We have a conversation where we imagine we're contained in this membrane, and then we imagine we're stepping out of it and just feeling the difference, and it's a very tangible, noticeable difference in the feelings. So what we're doing there, we're re-embodying that particular step in the development through our internal sensing, feeling, embodying process.
Yeah.
Does that make sense?
Yes, and what I'm hearing also is that in a way, as we're aware of how this is a process that goes at the tiniest level, unit, if you want, of ourselves, and goes back in time, there's a sense of, in embodying it, in reliving it, a sense of connecting also with something larger than just the experience of a moment and a self in the moment.
I absolutely, yes. And the pre-embryo, the stage, has no nervous system. It has no concept. So it is existing it is existing in the larger sense of the universe, I think, in a way. So definitely, I think these early processes really connect us to that sense of source, of spirit, if you like.
So it feels like at the same time as there is a healing aspect in the biology of it, there is also a healing aspect in a spiritual sense, a sense of having an understanding, a sense of connecting to our own place in the universe.
I think that's absolutely right. People do seem to find that connection as we go. I just like to use a model that comes from called process psychotherapy for a moment. They talk about source, being, and self. I find this a really useful way to framework for talking about this work. At this earlier stage, there is no sense of self as we adult, know it in our adult sense. But I think these early processes are able to connect us to a sense of being, often before disruption, before the splitting that might come through traumas and development. There's a potential for connecting to something that's very resourcing, sense of well-being that connects us to that sense of being and to that sense of spiritual or source, if you like. So there's a potential there for a profound reconnection, which can really be a source of healing or at least of support for exploring, places of trauma, places of wounding, disruption later on in the development. And that is often what people seem to experience there, that there is something before all of those journeys into coming into form and coming into self, that and all of the difficulties and pain around that there can be places that are deeply resourcing and healing, can be connected to through this work.
Yeah, so that sense of having that deep experience of well-being.
Absolutely, yes. And just going back, backtracking a little bit, I wanted to say that what we might do in the therapy room with that particular example I gave you about hatching, we might develop that into what's quite a familiar work, I think, in body psychotherapy, where we might be standing and facing each other then to sort of really bring it into the adult relational perspective, and then explore how that is to be in the room together with that sense of being closed, still in our shell, if you like, and opening out, and just that could be the beginning of a whole process of looking at what comes up there, what fears or come up, or what might have been causing us to continue to hold on to that early place of, I'm calling it withholding, because if we stay with a layer of protection too long, it feels like a withholding rather than a containing, protecting membrane. So if we stay too long there, we can start to explore, feelings might come up around that, and how it is to release ourselves from that. So that could open an area of exploration around why we might have held on to some stage of the development, why it maybe didn't feel safe enough, for example. So that's taking it forward into the developing personality patterns, attachment patterns, and so on.
Yes. So what I'm hearing is also there is a sense of going into different levels, crossing different levels, cross-experiencing from, say, early stage of development to the present adult relationship, from something that's deeply symbolic to the inner experience of what happens in the moment. There's a lot of that going back and forth of different levels. Yes.
Yeah. And sometimes we're working explicitly with that, but there may be times when, if the client's not ready to work at that level, I'm holding that as information and processing it in my own understanding of what's happening. But that's the potential to work in through those levels, and it can be quite profound. And when the client is ready to step into that level of work.
Yeah. So, Linda, as we're coming to the end of this conversation, is there something that you would want to add or conclude with?
I suppose I can, just on what we've been discussing, I would say that in sourcing back to this embryological work, what I'm finding is that my two threads of interest, which have always been present for me, the somatic work and the personal or spiritual approach to psychotherapy, really seem to be coming together there, which is a very exciting place to be working, to really coming together in an experiential way. That sense, as you were saying earlier, that opening through that, going into that very subtle internal and early work, opening into the sense of something larger than us.
Thanks for sharing that with us.
Thank you. My pleasure.
This recording is part of the Somatic Mindfulness and Relational Psychotherapy podcast. See the website relationalimplicit.com.